this is your lower extremity functional assessment. And as you'll see on the sheet, there's 6 range tests and 2 strength tests. This tells us what we need to know to determine your function. It's not exhaustive testing on purpose. When you set up an exhaustive system, you lose focus. The more things you do, the more data there is to process, and it's harder to tell what's signal and what's noise. The ID system makes this very streamlined and very useful. So yes, for the lower extremity, there are 6 ranges you need to know. And there are 2 strength tests you need to know. So we're going to walk through these, but briefly, passive knee flexion. Simple question. Does your knee flex? Full range, pain-free, with ease? Yes or no? If not, what are the details? This form and our testing will show you this. Number 2, does your knee extend? No one can argue that flexion and extension are the 2 main functions of the knee. That has to happen before anything else that I care about in the knee. Next test is knee flexion with hip extension. This is effectively a length test of the rectus femoris and a mobility test of the femoral and saphenous nerves. An extremely common lower extremity problem that can lead to all kinds of other issues with the kinetic chain. It's so important it made our list of these 8 tests. Next up is straight leg raise. This is simply put a test for the ability of your sciatic nerve to floss and your hamstring to lengthen. We do this test for the lumbar spine and hips, but it's also included here in lower extremity, and there's some details we'll get into on that. Next up is dorsiflexion. Can your ankle go into dorsiflexion? This is by far the most functional movement of the ankle. If you are to jump or land, walk, run, any number of things, you need dorsiflexion. And if you don't have it, you will compensate in a bunch of ugly ways that increase load on the joints above or below the ankle. Second to dorsiflexion is plantar flexion. Again, these are the big things these joints have to do. If you can't plantar flex, you can't raise up onto your toes, which also means you won't be able to jump. You won't be able to produce force if plantar flexion is significantly limited. More importantly is the structures that allow for plantar flexion are the ones that actually support the arch in the foot. The tibialis anterior runs down the front of the lower leg and actually attaches onto the bottom of the arch. So those tissues support and protect the ankle and foot. And we assess their function by assessing their range. Next up is the lunge test. This is overall a lower body strength test. This simply tells me, can you move your body through space with good function and relative ease? I cannot tell you how many marathon runners can't do a couple of lunges properly. So it's extremely important to know the overall strength status. And that's for primarily the hips, knee, the big force producers in the body. Lastly, we've got lockout test down here. This is the ability to basically get up into a full calf raise position, which is full plantar flexion under load. So those are the tests. That is your function for your knee and ankle and lower extremity strength. If you can do these things, you are functioning well. This is effectively a blood pressure measurement for your lower extremity musculoskeletal system. And this analogy fits damn near perfectly, because what is blood pressure? It measures load on your cardiovascular system. High blood pressure with increased load damages the cardiovascular structures over time. It does not mean you are currently symptomatic. It does mean you're at a far greater chance for stroke or heart attack. So these lower extremity functional tests don't tell me if you're symptomatic. they tell me if you're existing in a high load environment, which is ultimately very bad. So the better these tests are, effectively, the lower your blood pressure, the lower your load on your muscles and joints in the lower extremity. That's one of the biggest jobs we have, is to assess for function, and where it's limited, to improve it to normalize load, because musculoskeletal injury is an imbalance between load and capacity. So this one sheet, front and back, these 8 tests are how you do this. Once you see these tests in practice, you will not want to, or perhaps even be able to imagine how you used to practice without knowing this data.